I'm going to talk to you about the health problem of prediabetes and how to address the management. As many of you know, we in United Arab Emirates, the Gulf countries, and in the world are facing epidemic of obesity and diabetes. And we need to remember that obesity will usually lead to a stage of prediabetes before even developing diabetes. It is estimated that globally we have approximately almost 500 million people with diabetes, and that number is expected to reach 700 million by year 2045. It is also known that the number of people with prediabetes is already high in our country, the other Gulf countries, as well as some Middle Eastern and North African countries. It is estimated that prediabetes is present in nearly 1 in every 12 adults worldwide and 1 in every 11 adults in our region of the Middle East and North Africa countries. Looking at our Gulf countries, we can also see that the prevalence of prediabetes is almost reaching to the level of the prevalence of diabetes in these countries. It is important to remember that approximately 7 in every 10 persons with prediabetes will eventually develop type 2 diabetes over the following years unless we do something to prevent that. It is estimated that prediabetes is present in nearly 1 in every 12 adults worldwide and 1 in every 11 adults in our region of the Middle East and North African countries. Looking at our Gulf countries, we can also see that the prevalence of prediabetes is almost reaching to the level of the prevalence of diabetes in these countries. It is important to remember also that approximately 7 in every 10 persons with prediabetes will eventually develop type 2 diabetes over the following years unless we do something to prevent that. This means we need all to work together to support screening for diabetes and prediabetes and managing them as early as possible. I also would like to remind you that prediabetes itself is not a benign condition and it is associated with comorbidities and complications. The common comorbidities of prediabetes include obesity, cardiovascular disease, dyslipidemia, hypertension, renal failure, cancer, and sleep disorders. The common potential complications of prediabetes include microvascular disease affecting the nerves, neuropathy, the eyes and the retina, retinopathy, and nephropathy affecting the kidneys. It also can lead to cardiovascular complications even before developing diabetes. It is estimated that the risk of cardiovascular disease can be double in people with prediabetes when we compare them with normal population. It is also important to remember that microvascular complications of diabetes, including neuropathy, retinopathy, and nephropathy, can be seen in prediabetes, and for that reason, it is important to enforce early screening for diabetes and prediabetes. Worldwide, many diabetic societies and organizations recommended assessing prediabetes risk in questionnaires, such as the one used by the American Diabetes Association, Diabetes Canada, and Diabetes United Kingdom. The risk factors that included usually are the age of the patient, sex, ethnicity, family history of diabetes, waist circumference, body mass index, high blood pressure, physical activity, and smoking. By using such a questionnaire, a person would know that he or she is at higher risk for the development of diabetes or prediabetes, then should seek confirmation and diagnosis. This will be by checking fasting plasma glucose 2 hours after oral glucose tolerance test measurement, and also by measuring hemoglobin A1C. The cut point for the diagnosis of prediabetes are fasting plasma glucose when it is between 100 milligram up to 125 milligram, which is equivalent to 5.6 millimole up to 6.9 millimole per liter. And then this would be meaning that this person have impaired fasting glucose. 2 hours after glucose tolerance test measurement, if it is 140 up to 199 per deciliter, or equivalent of 7.8 up to 11 millimole per liter, and this is again diagnostic of impaired glucose tolerance. The third one is by measuring HbA1c, which is to confirm the presence of diabetes if it is done accurately, and also that the number is elevated between 5.7 up to 6.4%, which is equivalent to 39 to 47 millimole per mole. I'd just like to remind you that HbA1c is the most preferred method, but we need to be very careful in looking into that value, taking in consideration that the accuracy is affected sometimes by general condition, for example, anemia and others, which may lead to falsely increase HbA1c or falsely reduce HbA1c. After confirming the diagnosis of prediabetes, then the management should focus on prevention of developing diabetes. There are many prevention studies in type 2 diabetes using lifestyle modifications that have shown significant benefit in preventing diabetes. In addition, there are many other studies using medications in preventing diabetes, and these include metformin in addition to others such as pioglitazone, acarbose, and liraglutide. The important study that all of us look into is the United States study called the Diabetes Prevention Program that was done on people with prediabetes, and they compared the use of lifestyle modification and with metformin use. The result showed reduction in the incidence of diabetes by 58% with lifestyle compared to 31% with metformin. Because of this finding, many international guidelines recommended reducing the risk of diabetes, and these include the World Health Organization, American Diabetes Association, European societies and associations, the American College of Endocrinology, and even our own country here, the United Arab Emirates, where we updated our guidelines to prevent the development of diabetes by addressing managing prediabetes. Most of the recent guidelines, including the American Diabetes Association and the American Association of Clinical Endocrinologists, seem to emphasize that the use of metformin is recommended, as in case of lifestyle modification, if it was not enough in helping preventing the progression of prediabetes to diabetes. It's important to remember that the goal of managing prediabetes should be delaying the onset of diabetes, preserving beta cell function that involved in secretion of insulin, and preventing or delaying the microvascular or macrovascular complications. The lifestyle modification of prediabetes is very important, and the goal should be achieving weight loss and returning to normal sugar level. It should be done through comprehensive lifestyle modification program and should have regular reinforcement of that program. It is estimated that a weight loss of equal or more than 5% is needed to produce the beneficial outcome in reducing sugars blood pressure, and improving lipids. The exercises can be done as aerobic exercise like brisk walking, swimming, cycling, or jogging, and also high-intense exercises and supervised physical programs are recommended when feasible. The physical activity can be spread over 3 days per week with no more than 2 consecutive days without exercise. Weight training or aerobic exercises for more than 150 minutes per week are associated with a lower risk of developing diabetes. Nutrition and dietary therapy is important in the management. It is recommended to consider Mediterranean-style diets supplemented with extra virgin oil or mixed nuts. Also, DASH diet, which is dietary approaches to stop hypertension, is another recommended diet for that same purpose. Smoking cessation is an important part of lifestyle modification for people with prediabetes. Since smokers have increased risk of diabetes-related microvascular and macrovascular complications and premature death, also, cigarette smoking is a predictor of the incidence of type 2 diabetes, and avoiding smoking or smoking cessation should be encouraged for that reason. I would like to mention that in the United Arab Emirates, with our recent guidelines, we recommended screening prediabetes, confirming the diagnosis, and then advising the patient to be engaged in a lifestyle modification program, including diet and exercises, and this should be continue for 6 months. After that 6 months, we should repeat the blood test to see if there is improvement. If the patient improved, then we will continue with the lifestyle modification and to repeat these tests every 6 months. On the other hand, if not improving, then we need to add metformin, about 1500 milligram or more per day, and continue for 6 months also. The test should be repeated every 6 months, and if at any time during the repeated tests the patient developed diabetes, then should be treated as someone who have already overt diabetes following the guidelines for managing diabetes. Finally, I would like to end by reminding you of the importance of this prediabetes in our people in the United Arab Emirates and the Gulf countries. Awareness, education, following the updated guidelines with effective screening, early diagnosis and management. It is also very important to prevent even the development of prediabetes by intensive lifestyle modification. And also it is important to remember that the only drug that has been approved for managing prediabetes in most of the countries, including United Arab Emirates, is metformin. And with that, I would like to wish you a healthy life without diabetes and prediabetes in the years to come. And please stay safe.